everyone. Welcome to the Glow Podcast. I'm here today with a very exciting guest, and I'm super excited to speak with him. But for those of you who are new here, we are Tailored Marketing, and we partner with organizations in health, wellness, longevity to fuel growth through strategic marketing and sales strategies. So if you are interested, drop a comment below. Thank you so much for coming on. If you would, I would love if you would just go ahead and give a little bit of an introduction so the listeners know who you are.
Yeah, absolutely. First off, I'd like to say thank you, Taylor, for having me on Glow. I'm excited to be a part of this and talk to you about my practice and answer any of your questions. So my name is Dr. Stephan Goupil. I'm a double board certified family medicine and lifestyle medicine physician. I did become a physician as a second career, so I actually had a PhD in genetics of aging before that. I taught biology. Then I freaked my wife out by saying I was going back to medical school in my 50s. I did my residency in family medicine up here at UMass. And then after I graduated, I did urgent care for 6 months to find my footing. And then I was looking for my primary care practice, and I worked in two different hospital employed practices in an exciting primary care setting where I was doing what I've always done, which is patient focused medicine. In primary care, I noticed that most things with primary care patients fell into either chronic medical problems that were related to lifestyle choices or mild mental health things, like things that none of us have to deal with, like anxiety, stress, or mild depression kind of thing. And so I then sort of expanded as I grew as a physician, focusing more and more on those two things through lifestyle interventions and listening to patients. Why would anyone
Yeah.
want to do that? And drill down to what their concerns were. So, unfortunately, with the sort of traditional hospital employed medical practice, while they allowed me a lot of time with my patients in the beginning, there were pressures either from administration or financial pressures to shorten those visits and spend less and less time with my patients. So I always had in the back of my mind of like, one day I'll create my own practice and it'll just
Yeah.
be magical. And I don't know how I would leap from that chasm of being employed and having 30 years of medical and clinical experience to all of a sudden magically having a small business, basically clinic, and have
Yeah.
it working. But I was fortunate, and in my last practice, when I was feeling those pressures, financial pressures to see more patients, I had the opportunity to actually work with a functional medicine concierge practice to get a better feel of what functional medicine was, because I always felt like it was really interesting, had a lot of overlap with lifestyle medicine, but had some
Yeah.
things that I wasn't exactly fully embracing kind of thing. And so I thought I would learn small business there and how to run your own practice and a little bit more about functional medicine. And after a couple of months, both they and I realized that we did have slightly different philosophies, and we left on good terms. And they supported me in opening up my own practice, which I called Extended Healthspans, which I officially opened up just over a year ago and started
Yay.
seeing, and started seeing patients about 9 months ago, and now do have a small number of patients that I'm seeing where it is a private pay practice. So that was a scary thing, but that's allowed me to basically spend a lot more time with my patients, and I focus on preventative medicine, evidence-based lifestyle medicine, still traditional medicine. So I'm not practicing complementary or alternative medicine, although I always say I'm practicing holistically. My patients have primary care doctors, they have specialists, they engage in alternative medicine, and I embrace that. And the other exciting thing that I get to do in my new practice is get back to kind of my roots as a scientist and studying longevity. Is I get to employ these advanced labs that have been around for a while and are evidence based, and a lot of people that listen to possibly podcasts like yours have heard of some of these things, but it takes a while to trickle down to your traditional primary care doctor. And so I'm able to offer those to my patients, along with also offering and talking about things that functional medicine doctors do. Just I do it with a little less zeal. I don't push the
Yeah.
supplements quite so much, or some of those non-insurance paid tests. But again, I can engage my patients to find personalized plans for them, kind of thing. So that's what I'm doing right now.
That's super, super awesome. Yeah, no, I think that that's so great. And I think that you brought up so many good points kind of throughout when you were talking, and kind of how you've found almost like your niche, within like the medical space, because everybody is different. Like you said, when you were working for the functional medicine, you're like, okay, how I approach this is a little bit different than what you're doing, and I want to be able to do it kind of my own way. And I think that that's really, really cool that you realized that and like found kind of your space within that. And I also think something too that you said that I think is so important, because I think that so many people feel this now, is they go to the doctor, and they schedule this appointment, and maybe they're waiting a few weeks to go or however long, and they're like, okay, I need to get this issue figured out, or I need to talk to them about this. And then you're waiting in the lobby for, 20, 30 minutes, whatever.
Longer than the visit sometimes.
Exactly. And you've already been waiting weeks to see the doctor, and then you get there and you wait some more, and then you go back and you talk to the doctor. I mean, I've personally experienced this where I literally will see the doctor for like 2 minutes. And that's not an exaggeration, And like, if you're lucky, 10 minutes. 10 minutes, I feel like within the past probably like 10 years or so, I feel like 10 minutes is probably the maximum amount of time that I've spent with a traditional doctor.
Yeah.
And that is so crazy, honestly. So I totally understand where you're coming from with that, for sure. Being able to like, okay, I want to actually spend time with my patients. I don't want to just have to like turn them over as quickly as I can. I want to be able to actually listen to their concerns and what they're going through. And so I think that that's super, super awesome. And then another thing too that you talked about is the primary things that you're focused on currently are chronic issues that people are facing, and then also minor mental health issues. And so I'm sure throughout your career you've experienced a lot. And so why are kind of those the two things that you've chosen to focus on?
Yeah, because I think, as I mentioned at the beginning, those were what I saw the bulk of people in the primary care setting dealing with, that and then acute issues like a cold, twisted ankle. And so that's the niche that I kind of have carved out. Like, I'm like, I am not replacing your primary care doctor. I'm not doing those acute things. Still let me know, because sometimes those patterns are really, really important. But go see your primary care doctor for those acute visits, or if you don't have one, go see the urgent care doctor, because I've worked there, and the urgent care doctors oftentimes can do a better job of those than even the primary care sometimes can, because they have access to same day testing and x-rays and stuff like that. So I really chose to kind of focus on what I was expanding my knowledge on, which was lifestyle medicine, and what I was seeing as like the core problem with like people not being healthy. And so that was chronic diseases, whether you follow like Peter Attia, and he talks about the four horsemen, or what I used to joke about with my patients in our physicals, we would turn to the wall and I say, let's look at the wall of death. And it would be the top 10 causes of death in adults per the CDC. And so the big things on there that you see are cardiovascular disease, metabolic disease like diabetes, degenerative disease like dementia, and cancers. And those are really the things that I think that you have to focus on for both extending lifespan of individuals, and more importantly, and why I chose that name and why I think you hear the term a lot in functional medicine and longevity medicine, is we're not necessarily looking to double people's lifespans. We can easily get people to 100. It's how they get there. Like, medicine can get them, drag them through those last 10, 20 years. Well, we want to extend that health span and make them healthy. And so I think that focusing on, in an evidence-based manner, the prevention the treatment and the reversal of mild to moderate chronic disease when you have a tool like lifestyle medicine, when you also have a tool like traditional medicine. Again, I work with my patients and sometimes we include medications because guess what? Blood pressure medicines bring your blood pressure down. Statins bring your
Sure.
cholesterol down and reduce your risk of heart attack and stroke and stuff like that. And so what I can do is I have all that knowledge base and I have the time to spend with them instead of, like you said, and I don't fault the doctors, like particularly primary care doctors. They went into this, they'd love to spend more time with these patients. They just can't due to pressures and stuff like that. And so what it's done is shift us to, let me just hear immediately like your worst symptom and then quickly give you something to deal with that symptom instead of digging down to what is common knowledge. Even in primary care, we know that the root cause for these things are related to lifestyle medicine. And the pillars of lifestyle medicine are that it's related to your diet, it's related to your physical activity, it's related to stress management, it's related to getting good sleep, it's related to minimizing things like tobacco, alcohol, and drugs, and having healthy social interactions. The problem is in 5 and 10 minutes, you can't like expand upon those and you can't follow up on those when they're behavioral. And what you can do is wait until there's a big problem and there's a symptom and then give a medication for it. So I
For
have the
sure.
time where I can incorporate those things and oftentimes have them as first line or preventative, but at the same time work with patients when they need medications to understand why they might want to introduce those to reduce their risks of things like those diseases we talked about. In particular, one of my favorite and one of the favorite ones to do the more advanced labs with is cardiovascular disease because it's just the overwhelming killer of people. And we really can do a lot more risk stratification with these advanced labs, which allows us then to see whether or not we need to be more aggressive and maybe institute a medication sooner, or whether due to their personal risk stratification, we can, like, we have more time. And so we can focus on really saying, oh, so you're struggling with changing your diet. I know that can be incredibly hard, but look, we've only budged your numbers a little bit. Like if we don't change them, we may need a medication, but because you were a lower risk stratification because of the advanced labs I do, we can spend more time on that, engage part of a team, like bring in a dietitian, focus on what are the behavioral things that are making you have problems with this kind of thing. So,
Yeah. No, that's super cool. And I love that. I love like the lifestyle approach because I feel like what we're doing in our lives on a daily basis, I mean, it sounds like common sense, but obviously it's affecting our health and like our longevity and how we're going to be living in the quality of our health long term too. And so you mentioned kind of like the five pillars, and I love that. Diet,
so there's six.
exercise.
It's diet,
Okay.
exercise, minimizing obvious toxins like tobacco and alcohol, stress management and the mind body connection, getting good sleep. And then the one that wasn't really on my radar until I became fully board certified, but I now realize how important that is, but healthy social interactions. As we know, as people get older, if they are isolated, they don't, there's actually interesting data that the Surgeon General looked at a few years ago that if you are, like, he called it an isolation epidemic,
Wow.
and older people, if they're isolated, their morbidity and mortality, which is basically saying like what's their risk of death, is similar to someone that smokes a half pack of cigarettes a day. So
Wow.
isolation is that severe to our health kind of thing. So yeah, those are the things that we work on. It just, again, like you said, and it's funny. I mean, one of those classic like imposter syndromes in a doctor, like when I talk about lifestyle medicine so passionately, I'm like, well, it's so obvious. Like I give them one presentation when I go out and give these lectures, all they would have to do is eat better, exercise, and do these things. But the problem is that another crazy statistic is 97% of people are living and choosing, or not choosing maybe necessarily, but defaulting into unhealthy lifestyle. And so therefore it takes education and it takes time and it takes reinforcement to engage those, because they're behavioral changes, and they're not just a simple fix, take this supplement, take this pill kind of thing. You've really got to change this. And unfortunately, the other part of that is too, like, you need the support around you. Like the classic one always is when we would talk about smoking. If I would try and have a patient that wanted to quit smoking, if I knew there were smokers in the house, the likelihood that they'd be successful in that is just
So
almost
low.
nil kind of thing. So
Yeah.
you've got to have the people around you that are going to support you in exercising and eating better kind of thing. So it absolutely takes a team approach, both medically and in your social connectedness.
Yeah, no, that's so true. And I guess so then with those six pillars, like when you're talking to people, how do you kind of measure, I guess, like where they're at with each of those things? Is it kind of like you just talk to them and ask questions, or is there a specific like assessment, I guess, almost that
Yeah,
people can take?
I think there are specific assessments out there. I recall them like when I was doing my board certification, and I'm one of those people that, one, in medicine there's so many assessments kind of thing, you lose
Yeah.
track of them, and I just want to talk with the patient kind of thing. So I think like what I do is a fairly good job of, I know those underlying things that the assessment would be talking about, like what constitutes a good diet and exercise and stuff like that. And so I engaged them in a conversation, and in my template, I have those six pillars, and I just make sure that I walk through and kind of see where they're at, what they understand about that. And then at the end of it, kind of pick and recognize that you can't work on all seven of them at the same time. And so
For
I
sure.
always am like, hopefully there's two that you're doing really good at that we can kind of push this side. There's a few that we say, okay, little tweaks here, and then a couple that we're like, okay, we're going to aggressively kind of change these kind of thing. And then again, that's why it's important with the follow up. The regular follow up is to come back and see what worked. And again, sometimes even if you're like, okay, we're just not making any headway with like diet, maybe we've got to like focus a lot more on the physical activity, and the fact that we realized, like you said before, mental health stuff, maybe it's that your diet stuff is that you're stress eating or mood eating. And so if we focused more on stress management and meditation and even traditional treatment for anxiety and depression and stuff like that, then all of a sudden I've seen where people don't have that binge eating or that emotional eating or late night eating. And so you kind of, it's a moving target. But I think that the way I find it works best is talk to the patient, engage the patient.
Yeah, no, for sure. I feel like too, diet is one that like so many people struggle with. It's so easy to struggle with that because like even myself, I'll find that like during the week I'm very good and like I'm eating all the healthy things, and then like on the weekend you're like, I it's okay, like I can go out to eat or I can have the cookie or whatever.
Yeah.
So I feel like diet is hard.
And I always joke with people when I tell them like those six pillars and like what they have to do. I'm like, my goal is not to make you a miserable monk that's just eating
Yeah.
like vegetables and like exercising and meditating kind of thing. So there's got to be room for flexibility in there kind of thing. But at the
For
same
sure.
time, there also needs to be, and that's where I recognized in medicine, and it's really neat to see that lifestyle medicine is taking a bigger hold in medicine across the board, not just like specialists like me, but primary care doctors are understanding how important it is, even if they don't have the time. Specialists are understanding how important it is to outcomes with their patients. And where I'm going with that is, what is really exciting is it's making inroads into medical education, because that was the
Yeah.
thing. Like with diet, like I'd tell patients, I'm like, diet is really important. And I'd be able to give broad strokes like eat more plants, eat a whole food, plant based diet, eat a Mediterranean diet. But when you
Yeah.
drill down into the details of like someone like yourself, you're like, I'm eating that like 5 days a week. And then what am I allowed to cheat with on the weekend? Well, like we didn't have a lot of training in nutrition. And so that's where oftentimes, well, one, I've learned more, and that's been very helpful to me and my patients, but I embrace working in a team and bringing a dietitian in to kind of help with that. And I've seen it with one of my patients because I was like, we know she's cheating a little bit. And I'm like, again, don't want her to be that miserable monk.
Yeah.
But like, is that really why we're not seeing the weight loss? Because you don't want to be negative with the patient and be like, you can't have that apple crisp kind of thing. And that's where the dietitian that she works with on a regular basis has been really helpful because it's like, yeah, I think there is a little bit cheating too much, but the dietitian is able to help with, like, you still need to be able to enjoy yourself. And so helping them find healthier solutions or portion sizing with that like apple crisp kind of a thing that allows them to have that fun but still be able to make the overall diet work for them kind of thing.
Yeah, no, that's super, super awesome. And so I know you said too that you started your practice about a year ago. And so, what are kind of like your big goals with the practice? Like, what do you want to focus on, and kind of where do you see it headed over the next year or so?
Yeah, like growth. I hope to see growth.
Yeah.
I mean, I am a sole practice. I chose that specifically. I did a lot of the choices with my EMR to like automate those kind of things. Low overhead. I did think it was still important. I do a hybrid practice where I see people in person in those first visits and yearly, but I do telehealth to follow up kind of thing.
Yeah.
But I really, it has been. I always joke like I have well over 30 years of education in science and medicine, but the last year, and particularly those first 6 months, was a crash course in small business and how do you run
Yeah.
a small business and how do you do the things the hospital was doing for you before, like how do I pick an electronic medical record system, how do I get my own malpractice and stuff like that. And so I think I did a really good job of applying what we have as physician. I was a lifelong learner, so I applied it to learning business and I did really well and it's growing and I have some patients and I hope it continues to grow. What it needs to do though is grow more quickly. And so I do recognize, and this is what I'm working with, is you can't do everything on your own. And
For
so I'm
sure.
working with people like yourself and marketing people and business coaches because I absolutely recognize my business pain point right now is connecting with those people that I know that are out there and want this. And so it's marketing, not even necessarily the sales. I even worked in biotech and sales a little bit. So I'm pretty good about having the excitement about this and pitching it and
Yeah.
selling it, but it's having those patients find me and come to me that really is what I'm focusing on now. So the marketing is my pain point kind of thing.
Yeah, no, I totally get that. It is it's hard to go, like you said, you know the science so well. You're an amazing practitioner, but then you're like
Thank you.
there's this whole new side. Like I have to learn how to run a business now too and how to market myself and make sure that I have a steady flow of patients coming in and everything. And so I feel like yeah, it just adds a whole nother layer to it. I feel like as a business owner, you're having to constantly learn, and like especially with something like marketing that's constantly changing. It's like it's the
And
same
with
way as
technology and AI now,
yeah.
like, and it was it, when I hit that marketing point, and I did have an intern that helped me a little bit, but it was a huge learning curve, even from the other small business stuff. It was all of a sudden like, what is SEO? What is SEM?
Yeah.
Do I want to do social media marketing? Like, and all of this stuff that I very, very quickly like learned what they were, but then applying them appropriately. And then you throw AI into the mix now and all these algorithms that it's really one of those things where I'm like, you can learn this, but like, do I want to go learn to be a cardiologist when I'm a primary care doctor so that I can do heart surgery on myself? Or do I want to go to a cardiologist and have
Yeah.
them do this for me kind of thing? So that's where I'm at right now.
No, for sure that totally makes sense. Um yeah, no, it's So interesting. And so I'm curious with your patients, I know you're based in Massachusetts, so are all of your patients local or are you helping people all over?
Yeah, so that's the other interesting thing. And again, all these pivots of like, I've got all this education and credentials behind me. Do I need to go out and become a health coach so that I can expand beyond my border? Because I mean, I'm a licensed physician, so that has certain limitations. It means I can
Yeah.
practice medicine in Massachusetts. And I am. I mean, I'm coming from my comfort zone. And so I'm like, okay, let's start there. And I think I'm lucky. I'm
Yeah.
near Boston. I think I could probably do very, very well and grow my practice if I could just connect with the people in my area. So that's what I'm sort of focused on. But it brings up a good point as I do podcasts and stuff like that. There are other options you can go. Do you go broader and then more shallow kind of thing? So I'm trying to right now, again, focus on what a lot of my training in. And
Yeah.
so I'm focusing on looking at patients in Massachusetts or I'm close to New Hampshire. So if they're willing to come down here, I can see them kind of thing. But I'm not doing the broad coaching. I'm not doing the lifestyle medicine or health influencing online social
Yeah.
media stuff. I'm really trying to just work with like the individual patients. And if I could get like 150 patients, like I would consider this an incredibly successful practice for myself and for those clients that I'm working with kind of thing. So that's
That's
where I'm
awesome.
hoping to be in a year is growing to something like that. And then I always say you're only competing against yourself. I also like to I'm a triathlete and a runner and stuff like that.
Cool.
And
That's
and
awesome.
so like I'm like you've got to have your attainable goals, but then your far reaches. And who knows? Like I mean, if I start
Yeah.
getting more than a couple hundred patients, then you look at business again and maybe you learn more about that business and you grow that business and you take on other providers and you incorporate wellness coaches and dietitians. But right now I'm kind of doing what some of the functional medicine or DPC docs would call like a micro practice where I'm looking for like 100 and 150 patients kind of thing.
Yeah. No, that totally makes sense. That's super, super cool. I love it. Well, let everyone know where is the best place to find you online. I will also put all of the links in the show notes.
Yeah, I'd absolutely appreciate you doing that. And again, I mean, I recognize that social media is like a weak point for me, but I do have all those outlets. So even if you're not in Massachusetts and I can't provide necessarily a service to you directly right now, don't hesitate to look for me. Extended Healthspans is on Facebook and Extended Healthspans is on Instagram. You can go to my clinic's actual website at www.extendedhealthspans.com. I can be reached via email at Dr. Goupil at extendedhealthspans.com. So if you're going to be able to put those up, I don't need to spell them out
Yeah,
for you.
you're
So,
good.
I mean, that's great. And I mean, just going to my website, you can kind of see like my philosophy and apply that to yourself if you're not seeing me and use that to go and work with your primary care doctor or your functional medicine doctor or someone that's willing to incorporate more time and lifestyle choices into your care kind of thing. But please like and follow me so that it grows my social media. And I know that helps me even locally as well. So thank you so much, Taylor, for having me on the show. I really appreciate it.
Thank you so much, Dr. Gopal. I really, really appreciate your time.
Yeah.